So first of all, I'd like to thank the Movement Disorders Foundation of Arizona, as well as Dr. Evidente for inviting me. And thank you for all of you for attending the talk today. And today we are going to discuss urological issues in Parkinson's. And, these go by various names, which doesn't simplify the matter. Some people call it OAB or overactive bladder. Some call it urinary issues. Some call it urological issues. So we'll try to kind of address all of these encompassing terms of basically urinary problems in Parkinson's. And I work at the Booth Gardner Parkinson Center, which is located in Kirkland, Washington. And I'm also a professor of neurology at the University of Washington here in Seattle. So we know that Parkinson's affects more than 6 million people around the world. And most of the focus tends to be on the motor symptoms. And the motor symptoms we know can be tremor, rigidity, slowness, balance problems, abnormal gait, small writing, decreased blinking, a little masked faces. There can be some balance problems. However, what we are less aware of, or what is less discussed, is the non-motor symptoms. The non-motor symptoms, one of the commonest ones probably is constipation. A lot of people will have sleep problems. Sometimes there can be trouble with smell. There can be some memory problems, depression, anxiety. And one other less discussed problem is overactive bladder, in which people have urgency or frequency or need to get up in the middle of the night to go to the bathroom. So the urinary tract symptoms may appear in symptoms. And we know in Parkinson's, this is a cross-section of the brain. And if you see my cursor, you'll see that Parkinson starts at the front and proceeds to the back of the brain and moves from the base to the front, to the top. The non-motor symptoms can include urinary tract symptoms, and they can appear in parallel with the motor symptoms. And many people will not be aware that the non-motor symptoms are related to the Parkinson's. Now, lower urinary tract symptoms, which are for short called LUTs, are reported amongst Parkinson's patients, and they include two categories. One is trouble with voiding, and the other one is trouble with storage. Now, almost 24% to up to 96% of patients with Parkinson's will have lower urinary tract symptoms. And more than 60% of patients with Parkinson's will notice that they have to get up in the middle of the night to use the restroom. Now, the storage symptoms include inability to store. So there can be urgency, meaning you have to go and you have to go now. Frequency, meaning needing to go to the bathroom several times a day, more than normal. Getting up regularly in the middle of the night to go to the bathroom, or leakage. Together, these are called overactive bladder symptoms. Voiding symptoms include hesitancy, meaning trouble getting the stream started, straining, meaning having to push to get the stream, interrupted stream, meaning the stream starts, stops. And then last of all, there can be retention, meaning the bladder does not empty completely. So even after a void, there's some urine left behind in the bladder. So why are we even discussing bladder problems? Well, one, people feel limited to carrying out their day-to-day activities near the restroom. So whenever they empty a place, they need to kind of scope out where's the restroom, just in case they need to use it. Now, if a person needs to quickly make it to the bathroom, it increases the risk of a fall. And then there can be a fracture if one's trying to rush to the bathroom, especially in the middle of the night. Now, there can be trouble continuing to be safe at home if there are going to be falls due to rushing to the bathroom. This can lead to increased anxiety as well as depression. And there can be increased care partner strain because when there are leakages, you need to get up in the middle of the night to either clean the floor or clean the bed sheets. So all of that can lead to a large amount of hassle, both for the person with Parkinson's as well as the care partner. Now, this, if you see, this is a simplified diagram. I didn't even put all of the control centers, but you'll see there are several control centers of the bladder. There's one that's in the brain, another at the hypothalamic level, there's another at the brain stem level, and there are other complex pathways in the spinal cord, which is why it's hard to treat bladder problems because you're not trying to just address it at one level. You're trying to handle all these multiple reflexes. There are actually 7 pathways that we know of that connect the brain through the spinal cord to the bladder, and some of them can act independently, some together. So we are trying to treat all of these various control centers over the bladder. The next slide is what our physical therapist has written.
This presentation was created by Amy Ross Gordon and Pat Chalk, both physical therapists at Evergreen Hospital, and Sherry Albach, research assistant for Evergreen Research. The topic is behavioral training for bladder health. So what is normal bladder function? We define normal urination as 5 to 8 times a day, which works out to be about every 2 to 3 hours, and not more than 4 hours between daytime urination. Normal nighttime urination is once or twice in the evening or overnight. Your goal is to urinate a steady stream for at least 8 seconds. Where do we get this number, 8 seconds? Normal bladder capacity is estimated to produce urination of at least 16 seconds. So at least 8 seconds means that the bladder was at least halfway full. This leads us to the important concept of no just-in-case urination. Try to avoid it if you can. The following are good bladder habits to keep in mind when trying to manage symptoms of urinary urge and frequency. The best beverage for your bladder is water. You want to maintain good fluid intake, and for most people, this is 6 to 8 cups per day, equal to 48 to 64 ounces. It's best to space out your fluid intake throughout the day rather than drinking large amounts at one time. Please do not try to limit your fluid intake in order to manage your symptoms. Actually, it makes urine more concentrated and irritates the bladder further. It may also lead to increased bacteria and infections. Please pay careful attention to limit bladder irritants that can cause increased sensation of urgency and frequency. And we will go through common bladder irritants on the next slide. Alcohol in particular is important to avoid. Alcohol not only increases your urine production, but it also makes it difficult for the brain to coordinate bladder control. Lastly, cigarette smoking is very irritating to the bladder and can increase your risk of bladder cancer. The following are common bladder irritants. The tissue that lines the bladder is very sensitive, particularly to acidic liquids and other foods. In particular, citrus fruits and juice and tomato-based products, which are all high in acid, as well as cranberry fruit and juice, are to be avoided. What you may not recognize, though, is that the bladder is very irritated by artificial sweeteners. There is something in the chemical makeup of artificial sweeteners, like sweet and low, which can irritate the lining of the bladder. The bladder is particularly irritated by coffee, which many people are aware of, but decaf coffee and decaf tea can also be irritating because of their acidic properties. Along the lines of acidic drinks, spicy foods and curry, and also vinegar-based foods can be irritating to the bladder. Carbonated drinks, really anything with bubbles, can irritate the bladder as well. For all of these reasons, diet soda and regular soda are particularly strong bladder irritants. Diet soda has artificial sweeteners, carbonation, caffeine, and artificial colors and flavoring that can irritate the bladder over time. The following are some bladder-friendly alternatives: apricot and pear fruit and juice, watermelon, papaya, and berries are all relatively neutral. You can also consider diluting your juices to decrease their acidic properties. Low-acid coffee is now available commercially, and non-citrus herbal tea is a good option. Green tea, which has a minimal amount of caffeine, is also fairly neutral. Alternatives to coffee include postum and caffrey roma.
So, the recommendations there are not very different from what we know is a healthy eating plate, which is, some fruits, vegetables, again, avoiding very citrus fruits, having whole grains, having healthy protein, and plenty of water. You'll notice it's water, it's not caffeine or sodas. So if one does have them, they have to be had in moderation.
Bladder retraining is a useful way to manage urge and frequency symptoms. The goal of bladder retraining is to restore normal bladder capacity in order to eliminate the false alarms that you may be experiencing. If you're unable to delay the urge of a possible false alarm with the previous urge delay techniques, then at that time, you should walk slowly and controlled to the toilet. Again, do not rush to the toilet and count how many seconds of steady stream urination occurs. Your goal is an at least 8-second urination. If it was less than 8 seconds, then what you experienced is a false alarm. This is a great opportunity to then reprogram your bladder with self-talk. While this may seem kind of silly, having these conversations with your bladder immediately after you experience the false alarm gives you the opportunity to reset your awareness of bladder capacity, and over the course of 10 to 14 days can make a big impact on the false alarms that you're experiencing throughout the day. The following are useful urge delay techniques. When you experience a strong urge to urinate and it has been less than 2 hours since your last urination, the first thing to do is to stop and be still. Although this may be contrary to what you may feel like doing when you get the urge, please resist the temptation to rush to the toilet. Instead, you should begin pelvic floor contractions. Pelvic floor contractions, or Kegels, as we'll discuss later, are useful in sending a calming signal to the bladder that can often quiet the strong sense of urgency that you're experiencing. It is also important. There are other ways that you can control your bladder urge. Urinate when you first get out of bed in the morning. If you feel like you may not make it to the toilet, squeeze the muscle that holds back urine before you get up and count to 10. Then get out of bed and walk slowly to the bathroom. Also, when you feel the urge to urinate, try to distract yourself. Think about a very complex task, like remembering all the words to a favorite song, a nursery rhyme or hymn, or think about something fun, like your favorite pastime. If you get uncomfortable and still have the urge to go, you should use the toilet. Do not be discouraged if this happens. It's normal.
So, in addition to lifestyle modification, sometimes we need to make use of practical options. And one of those is that at night, it may make sense to use just some kind of bladder protection. It could be using disposable pull up diapers. And sometimes, if one does not want to change the entire pull up in the middle of the night, then one can add a pad inside the pull up. So in the middle of the night, one is just changing the pad inside the pull up and not having to undress and change the entire pull up. It helps to make sense of waterproof bedding, and then regular visits to your physical therapist for bladder retraining and pelvic muscle training exercises. And after this, we'll have, our physical therapist will show how to, will do the narration as to how to do these pelvic muscle contractions. Because in Parkinson's, people can sometimes be off at night and there can be balance problems. It's important to have grab bars in the bathroom and have bed handrails, non-skid services in the bathroom, raised toilet seats, low beds, because you want to be able to step off easily from the bed, ambulatory aids, like even if you don't use ambulatory aid like a cane in the daytime, it makes sense to use one at night when you may be off or when you may have taken something for sleep. So you could use a cane or a walker or a wheelchair at night. And then good lighting, like contrast colors to generate a clear path to the bathroom. Make sure you have night lights on at night so it's easy to see where and how you're going to the bathroom.
Following is an overview of pelvic floor anatomy. I will introduce the female anatomy, then the male anatomy. The pelvic floor is made up of 9 muscle groups organized into 3 layers. So we can simplify the anatomy by focusing on how the muscles form a figure 8 around both of the openings. On the screen, you can see the top figure 8 around the vaginal opening and the bottom figure 8 around the anal opening. From the side view, we can appreciate why the pelvic floor got the name floor. If you look at the red line here coming across, which represents the pelvic floor muscles, you can see how the pelvic floor muscles form a hammock or a sling shape that supports the pelvic organs from down below. So how do you perform a Kegel? If you focus on the figure 8 and attempt to try and stop the flow of urine and hold back gas at the same time, those pelvic floor muscles will be engaged. The muscles should draw up and in towards your head, and you want to make sure that you relax your inner thighs and your buttocks. The most common mistakes people make when doing Kegels is they overuse their inner thighs and buttocks muscles. And last but not least, please make sure that you continue to breathe throughout the exercise. Your Kegel home exercise program can be performed either sitting or lying down. As mentioned earlier, it is important to maintain relaxed breathing throughout the exercises. You may want to consider counting out loud while holding your Kegel to avoid holding your breath. The following is a sample exercise program for doing your Kegels. It's important to perform both quick contractions and endurance contractions to work both the fast twitch and the slow twitch fibers that make up the pelvic floor muscles. For quick contractions, hold for 2 seconds, relax for 4 seconds, and repeat 10 times. Perform 2 sets of 10 contractions. For the endurance contractions, your goal is to hold up to 10 seconds, relaxing for 10 seconds, and repeating 10 times. Kegels can be performed during many functional activities. In fact, one of our favorite sayings is squeeze before you sneeze. But you can remember to do Kegels with many physical activities, for instance, before coughing and sneezing and before lifting and bending. You can tighten the pelvic floor muscles before going up and down stairs and moving from sitting to standing, and also during exercise. It's useful to practice your Kegels habitually throughout the day during daily activities. You may want to do your Kegels while waiting in lines, like at the grocery store, performing yard work, driving, brushing your teeth, during sports, cooking, and also during commercial breaks. Pelvic health is a fitness issue. The strength and coordination of your pelvic floor muscles depend on ongoing attention to conditioning. Your home exercise program is best performed at the same time each day. For instance, while falling asleep at night, before getting out of bed, or during commercials. Just like brushing your teeth, make this a daily routine. Use it or lose it.
So the message is that we should avoid just in case peeing, which is avoid going to the toilet just in case. Try to urinate only when the bladder is full. It is not usually necessary to urinate when you first feel the urge. And urinary urgency and frequency can be improved by bladder retraining. Don't let the bladder control your life. Now, you may be able to do this yourself, but also if you go to your physical therapists are trained to improve axial tone, and that includes the pelvic floor. So, your physical therapist can help you not just with gait and balance, but also with how to make your axial muscles stronger in order to have better bladder control. Now, coming to pharmacological or medicine management, the typical medicine that we use for Parkinson's is carbidopa levodopa. And there is this medication called apomorphine, which is, an injectable or sublingual form. And some studies have shown that it's possible that it may improve bladder function, but it's not known for sure. And other studies suggest that there are some medicines that can decrease bladder contractility and therefore urgency. However, they may impact cognition, and I'll come to that in a few slides from now. So these are some of the current, now these meds are not specifically for Parkinson's and overactive bladder. However, these are common medicines that you may get prescribed either by your neurologist or by urologist for overactive bladder. All of them work by an anticholinergic mechanism. And some of the names that you might recognize will be Enablex or Sanctura or Vesicare or Ditropan, Detrol or Tobias. Now, because they have, they block acetylcholine, which they're supposed to do mainly in the bladder, there can be a little bit of overflow. And because of that, some medications such as Ditropan or Detrol may cause some dry mouth. Some medications like ditropan or oxybutynin, they can to a certain extent trickle across into the brain. And some people will notice that their memories, a little decline in their memory when they start ditropan. So if you are on ditropan and it's helping the bladder, but you feel that, oh, I'm not feeling as clear headed as before, it may make sense to switch to some of the other medications on that list. Now, if sometimes these meds can be a little constipating too, and if they work a bit too well, instead of having urgency, you may notice that now it's too hard to get the stream started. The other medication group for treating overactive bladder is medications that instead of working through acetylcholine, work through a different adrenergic mechanism. Commonest one of these is mirabegron or mirametrine. And there's a newer one called Gemtesa or Vibegron. Now, our center did a study looking specifically at mirabegron in Parkinson's, and the patients did quite well. You do have to monitor for nausea, constipation, headache, dizziness. Sometimes it can have a little effect on the blood pressure or on the heart. Again, these are possible side effects. So it's not, only a few patients get it, but it's important to be monitored for these side effects. Now, some other options are your urologist might mention to you percutaneous tibial nerve stimulation. And basically, there are connections between the tibial nerve and eventually the pudendal nerve, which can control the bladder. It does need several trips. Sometimes they do it even 5 times a week for several weeks at a time. And most of the time, this will be offered in your urologist setting. Again, some patients with Parkinson's might notice benefit with this. None of these are approved specifically for Parkinson's and overactive bladder, but these are what are typical modalities used for treatment of overactive bladder, whether it's with or without Parkinson's. Other options, other non-oral medication options is Botox injections to the bladder. And it is done through an endoscope. And then there are lots of little shots that are made inside the bladder. For some patients, it can be effective. A possible side effect could be retention, meaning if it works a bit too well, for a couple of weeks, people may have backup of urine and they may actually need to catheterize themselves for the first couple of weeks until the side effect goes away. Now, sometimes patients with Parkinson's, in addition, have an enlarged prostate. And then the question comes up, oh, should they have the prostate surgery or no? So you have to rule out Parkinson's plus if you're going to do prostate surgery. There is a particular condition, Parkinson's plus, called multiple systems atrophy, or MSA. We should not do prostate surgery in patients with MSA. However, if it's just Parkinson's disease, it has to be handled on a case by case basis. And some patients may benefit, some may not. So it has to be a conversation between your urologist and your neurologist. If overactive bladder is a big complaint, then it does help to have a urologist as part of your care team. So your neurologist and urologist can communicate with each other to come up with the best option for you. Now, deep brain stimulation, we know, is an effective treatment for the motor symptoms of Parkinson's. We don't have so much data on how it helps with the non-motor symptoms. One study with deep brain stimulation reported that patients had less nighttime urination. And other studies have reported that DBS had no significant effect, like no worsening, no benefit on urinary symptoms. And so we definitely need larger studies to to evaluate the effect of DBS on Parkinson's overactive bladder symptoms. So overall, approach to Parkinson's is find a team you can trust. And in addition to that, I would, on a case by case basis, you need to add other specialists. If overactive bladder is a major problem, then you need to add a urologist to your team, a physical therapist who can work on core strength. Educate yourself like you're doing today by attending programs so that you're aware of what could be a possible PD symptom that you're not aware of. Exercise tends to help with all symptoms, whether it's motor or non-motor. And sometimes it can be overwhelming, when you're made aware, oh, I could have this, I could have this, I could have this motor symptom, this non-motor symptom. Try to have the gratitude. Try to have the gratitude that, okay, I'm here today and I've got to make the best that I can today. And, I can still socialize with my family, with my friends. So have that positive attitude of gratitude, which can go a long way of giving you the mental strength to deal with these symptoms. And again, participation in research is important. There is increasing research happening in overactive bladder. At our center, we've done 3 or 4 clinical trials involving urinary symptoms. One involving the mirabegron in PD, we just completed a few months ago, and the data is still being analyzed. But in general, I mentioned some few clinical trials in Parkinson's that are out there. Generally, they're categorized into recently diagnosed trials that are for motor symptoms, for non-motor symptoms. Typically, your overactive bladder symptoms will fall in the non-motor group. And sometimes there are just biospecimen collection studies. Now, all of these, even if you were to just donate your biospecimens like blood or urine, it does help to contribute to the understanding of the condition. So now these are some of the recently diagnosed studies that are going on at our center, and probably somewhere closer to you in Arizona too. Now, interestingly, actually, I forgot to write urine over here, but there is study going on called Neuron 23, in which they're looking at three biomarkers actually: spinal fluid, blood, and urine. And the reason is that they're trying to see if some of the biomarkers for Parkinson's could actually be detected in the urine. So patients have to collect approximately, a jug of urine, so about 5 hours worth of urine, and they bring it to our center, and then we spin it down, and then we examine the sediment. And the idea is to see that the same alpha synuclein abnormal protein that we can see in the spinal fluid, can we actually see it in the urine or no? So urine has several uses, in understanding Parkinson's and overactive bladder. I hope I've improved your understanding somewhat of how important a symptom it is and possible treatment options. So with that, I'll conclude the talk today, and thank you very much for your attention.